where you have transitions where the body is coming off the birth control pills, so it needs to retrain itself how to communicate between the brain and the ovaries. There you can help the body with nutrients and gut support and lifestyle changes for the body itself to balance itself. It's not that the ovaries are not working anymore. It's not that the woman is in menopause, but there is a transition.
And welcome back to this week's episode of the High Daily Rhythm podcast. If you haven't met me, my name's Natalie Smythe. I'm a naturopath and meditation teacher, and I'm guiding you on this journey with FemGood, a holistic well-being platform dedicated to supporting women from menstruation until menopause through holistic and Vedic lifestyle practices. Now today, as always, I know I say this, you're in for a treat, but today you truly are by the presence, the reverence, and the knowledge of Dr. Salome Masghati. She is a board-certified OB-GYN, fellowship-trained in minimally invasive gynecologic surgery, and certified in functional medicine. So she's the founder of Precision Gynecology, where she brings together advanced women's healthcare with functional medicine and hormonal optimization to help women thrive with vitality and balance. So Dr. Salome's approach is both scientific and deeply personalized, blending the precision of surgical training with the innovation of longevity medicine to support women in their 30s and beyond. So there are so many takeaways, so many nuggets of wisdom that any women from their 30s or preparing for the premenopausal, postmenopausal fertility journey need to listen to. As always, please like, subscribe, and share this episode, because the more people hear about this wisdom, it doesn't matter if you're a male, a father, a brother, a friend, an aunt, uncle, people need to leverage and hear women's health so we can really move the needle to change public policy so we can make it accessible to all. Thank you so much, Dr. Salome Masghati. We are so lucky for you to be pioneering this approach in women's health.
Thank you for having me. I'm so happy to be here.
And you've built an incredible practice combining board-certified OB-GYN expertise with functional medicine and then surgical fellowship training. So before we dive into the science, I'd love to hear how you ended up doing this, because I can imagine maybe it would have had personal insight and your journey through your own hormonal challenges and what that experience was like and how it shaped your practice today.
Yeah, absolutely. I've always loved women's health ever since I was 16, 17 years old. In high school, I loved hormones. I loved biology. I loved chemistry, but I loved hormones. They're such powerful messengers and they do so much. And especially for a woman, I remember having read a book at 17 about how much estrogen is important for the vitality of a woman. And my dissertation in high school in Austria was about hormones. Nobody at 17 years old thinks about menopause, and I did. I was always drawn to it. Then I went on and pursued my career in women's health because I love the surgical and procedural aspect of my specialty as well. I love being able to take care of things and helping women get rid of their fibroids or do endometriosis surgeries or get rid of their pain from cysts. And it was such a quick result. And that was partly something that I also love doing. But during my training, we had a lot of night shifts, long hours. I was always inside in a hospital. There was moldy carpets and AC vents. There was no windows. We had 90-hour work weeks. We would do sometimes week after week night shifts without any recovery. And I remember there were days where I would stay up in the OR until 1 a.m. to assist attendings and then go back at 5 a.m. to round on patients. It was very taxing on my body. I still went on and did a fellowship in surgery, additional 2 years, added to the 4 years of residency. And that was additional stress. It was a lot of long working hours, robotic surgery, fumes from the electrocautery of cauterizing tissue. There was just so much stress on my body. So my body tanked, my adrenals tanked, my sleep suffered. I could not relax anymore. I remember there were periods where I started just crying out of nowhere in my car on the way to work. I could barely hold it together for my patients in clinic. I was just easily overwhelmed. It became grumpier. I couldn't sleep. And I feel like I probably tanked my adrenal and ovarian function then, but I didn't test myself. It wasn't until I left the fellowship, COVID happened, And then I did some lab testing that I figured out I was in perimenopause. I had basically put so much stress on my ovaries and my body from multiple things that just really brought me into that perimenopause. So that's when I started trying to correct my own hormonal issues, looking into my thyroid, estrogen, progesterone, and then also learned more about hormones than I had in residency. And I added functional medicine training to that. So now the last 4 years, that's where my practice has been focused on. And I've left the hospital system so I can have more of a work and life balance.
Oh, wow. I mean, but that just shows your perseverance and your love for the hormones and the expression for women's health, because some
Yeah.
people might not have gone down that path to go into the functional medicine testing to realize that there is this thing of hormone balance versus hormone optimization. I think that's
Yeah.
maybe a new terminology. Um,
Yeah.
so I guess if we can go back to the fundamentals, when
Mhm.
we talk about hormonal optimization versus
Yeah.
hormonal balance,
Mhm.
what's that distinction, and what does that framework look like for women?
Yeah. So for me, I think that I'm not sure if I'm capable of making such a distinction, but what I look at is a spectrum of things. The body is always a spectrum. It's never black and white. And then you look at the person and you look at their
Mm,
age and their context. But there are a lot of times in life where you have transitions where the body is coming off the birth control pills. So it needs to retrain itself how to communicate between the brain and the ovaries. There you can help the body with nutrients and gut support and lifestyle changes for the body itself to balance itself. It's not that the ovaries are not working anymore. It's not that the woman is in menopause, but there's a transition. Or when a woman undergoes childbirth and postpartum, she's going to undergo a transition. So these are phases where you get by just supporting the body's own natural rhythms and nutrient support and helping her with inflammation and lifestyle and nutrition. And then there are phases in life where really, despite everything else you do, there are going to be changes to your biology based on your ovarian function declining. And there will be need for also replacing hormones. And so I always take that into consideration for women. I have younger women with PCOS where sometimes you still need to give them hormones even in their 20s because there are just things they are not managing to produce themselves, even though you do everything to support them. And then there's phases where it's just transitional. You can support the body and it will balance itself out. So maybe that's a good distinction to make. In perimenopause and menopause, there is absolutely an objectively verifiable decline of hormones. We can measure those levels going down. And that is probably where the majority of women feel the biggest changes because that lasts for them. That's not transition. It's not just related to her menstrual cycle or postpartum period. This is something that doesn't go away. And so they do need more help than just balancing her with nutrients and lifestyle.
mm. I guess perimenopause is having a bit of a cultural moment at the moment because women are speaking up about it. Workplaces are speaking out about, there's so much press about it finally, which is great because information makes changes in policies, et cetera, and research. So I
Yes.
guess, but also what I'm noticing on the flip side is that everybody is self-diagnosing with perimenopause, even, women in their 30s. And there's like
Yeah.
this stress that overrides with that when, then at the same time, people are stressing about perimenopause and then maybe wanting to look at getting pregnant. What are some of the symptoms that women can look out for? Or also, how can they prepare themselves for longer ovarian reserve as well? Sorry, there's a couple of questions in there.
These are great questions. And I wish I had addressed that for myself because this is what I experienced in my earlier 30s. It was too early for me to experience perimenopausal changes. But when you do things that are super taxing on your body, this can happen. Or if you're
Mm,
exposed to toxins, which we all are to a certain degree, right? Our environmental toxins, we have endocrine disruptors, we have microplastics, we have heavy metals. We know they can enter our bodies through air, water, food, and then they go and they block hormone receptors or they change the structure of the cell membrane. They can change the way cells communicate, and then they can cause hormonal havoc, and they can put a lot of pressure on the liver to detoxify and get rid of them, which the liver also has to metabolize our hormones. So there's a lot of factors that can contribute. And the excess blue light that we're exposed to, lack of sunlight, lack of, you know, exercise. We have sedentary lifestyles. I mean, at the hospital, I was running around, but I was also sitting a lot in front of a computer. I never saw the sun. I would go in at 4 a.m., I would leave at 8 p.m. That is not a healthy lifestyle long term. The food at the hospital was the worst food you can imagine. It was lacking protein, it was quick, absorbable processed sugar. I didn't do my body any favors. So if someone is trying to preserve the ovarian reserve for fertility, for healthy outcomes, to delay perimenopause, to delay menopause, there are things that they can do. They can optimize their circadian rhythm. They can get sunlight in the morning, get exercise, get fresh air. They can eat a good protein rich, fiber rich diet with lots of phytonutrients, fresh fruits, fresh vegetables, kind of a more Mediterranean type of diet. There's some data that might have beneficial effects on oxidative stress, and inflammation is what makes our ovaries stop functioning as optimally. You know, when you have omega rich free foods in your diet, like sardines and salmon and fish, you reduce your oxidative stress on your cells. That includes your ovaries. And then you want to prioritize sleep. I didn't have that privilege. I couldn't make a choice. I couldn't say, I'm not coming to my shift. I had to finish my training. I worked so hard for it. But if you have a choice, don't stay up really late because you're watching a Netflix show. You know, if you have a choice, read a book, wind down, go to bed by 10 p.m., do meditation, maintain a good circadian rhythm, a good sleep cycle, maybe abstain from drinking alcohol too much, maybe abstain from eating super processed sugar. So there are a lot of things women can do. They can work with people like me and the group of amazing nutritionists and health coaches that I work with, where we can check nutrient levels. What are you lacking? Because if these nutrients like zinc or B vitamins are lacking, that's affecting your immune system, your methylation processes, and it affects your ovaries. So there's a lot you can do before it gets to the point where you have to take the hormones to balance yourself out. So, and I am also extremely fascinated. I wanted to share that with you in a lot of regenerative processes and longevity protocols. And there seems to be some data that we can even use our own body's stem cells in addition to all the lifestyle interventions that I mentioned to you, where we could help preserve the ovarian function a little bit longer. That is something that I am looking into getting started in my practice as well, just to give additional support for women who are looking for extended fertility or extending the life cycle of their ovaries. So those are very fascinating topics to me. I love that you asked that. Yeah.
Yeah, I mean, I think that's really interesting because we certainly are redefining
Yeah.
aging for women, aren't we?
Yeah.
You know, we don't our parents don't look the same as our grandparents and what we imagine them, and then we will also be very different. So I think it's so interesting, this longevity
Mm.
medicine that's happening and all of the tools and techniques and you being
Yes.
at the frontier. And I think we're very lucky because you were just at an optimization and longevity
Yeah.
summit conference, weren't
Yes.
you, last week? So it
Yes.
it sounds like what because these things that you speak about, they're common if you're in certain circles or if you have had challenges, you know how important they are. But for the general Joe public, these
Yes.
are things that, like, they're not very sexy. They're like habits that you have to build, and they're quite, simple in what they are. But I think a lot of people or women don't take them as serious as how they can really impact and completely change your biology and health outcomes. So, what have been some amazing research that you've seen based on circadian biology and everything that you've seen?
I do think that there's an amazing impact of our circadian biology just because when you look at women who are more in sync with nature and in sync with a healthy sleep-wake cycle, in sync with having a balanced lifestyle. When you think of someone who there is someone as a friend who does retreats in Costa Rica, and there's all these very busy CEO women. They go there and they just wind down and their cycles normalize again, just from
Mm.
reducing the stress, implementing some meditation, some yoga. They have a private chef, so there's healthy food there. They're getting lots of sunlight. They're walking and grounding on the beach, and they're lowering their EMF exposure from all these 5G towers. You combine all of that, and the body can breathe again, and it allows the cells to heal. And that just has such a major impact. So it's not until they feel that. You can
Mm.
talk to them all you want while they're still behind their desk and their computers in an office. You can give them all these choices, but it's not until they actually go there and experiencing that themselves, the period cramping resolves or the period, their cycles resets itself, that they understand how important that biology is. The body is meant to heal itself at core. The body wants to heal. The body doesn't want to be in an unbalanced state. It wants always to be in homeostasis and in balance. It's just the tools that we give it and allow it to do so. And everyone has tools depending on where they live. They can explore them in different ways. For example, I often get pushback. I live closer to the equator. I'm in Florida. I get good sunlight. This is very important for me. I have very sensitive mood when weather changes happen, and I don't do very well with lack of sunlight. My ancestry has been always closer to temperatures and sunlight and warmer temperatures, where there are people that I have that are more in the northern states, and they complain about the lack of sunlight. And I talk to them, there's specific lights. You can get your exposure to 10,000 lux. You can get a Spurdy lamp, or there's other brands, and you can imitate that sunlight in the morning just to wake up your pineal gland. But you still can go outside and work out. You still can go in sauna. You can still eat healthy, and you can
Mm.
adjust your diet to the needs of where you live, obviously. Like colder temperatures, you might need more fatty meals. You might need a different type of calorie intake. But everything is possible. All these tools are available to people. But as you said, they're not sexy. And often people don't understand until they feel the effect. And that's
Mm.
not until they go on vacation or they spend the summer in Europe and they walk around and eat healthier food that they're like, oh, so I don't have to be bloated. I don't have to have crampy periods. And I walked so much and I ate so much, but I still didn't
Mm.
gain weight. There is experiences that can also make it easier for us to communicate that to the patients so that the clients are more open to these tools. But the hard part is implementing it in your everyday practice to create habits. Those habit creations, that's the hardest part. And women are overwhelmed, and they get sometimes fear out of missing out of the sexy tricks and the hacks that maybe are costly or certain devices, but they forget the basics. So I agree with you. I think the basics are where we have to start with.
Mm. And what are you noticing when women implement the basics? What are you noticing in your practice now compared to a couple of years ago? I know it's mainly been not so long since being in the hospital, but yeah,
Yeah.
what are you
I love
experiencing now?
that question. That's a great question. The feedback I get from patients is always different. I have to admit, and this is not to just try to compliment myself, but I've always had a little bit of a tendency to implement natural stuff in my practice. Even when I was a resident, I would tell patients about magnesium and B
Mhm.
vitamins. I was informing myself on social media and just learning all the time. I do get a lot more feedback now about things that I never even looked into when it comes to gut health. Like I had a patient who lost 10 pounds just from us addressing her gut issues, doing a gut stool testing, helping her with her dysbiosis. She's so happy. When I get that
Mm.
feedback, it means the world to me to see that I've impacted her in such a way where she feels comfortable having sex with her husband because she's no longer bloated. The way I get feedback about when I help someone optimize their cycles or their hormones in perimenopause or menopause, for example, it's life changing for women if they can sleep again
Mm.
or they can, lose the weight they want to lose. They feel good in their bodies. They have libido again. So that feedback means so much. Whereas before, most of the feedback came from, I did your surgery. They would hug me, their uterus was out. They had a lot of bleeding. They had a lot of pain, but it was a different feedback. Now I have a lot of continuous relationships where past that moment of making changes, we continue that relationship. So there's a little bit more of a long-term relationship that's built there. It's more preventative. It's more a continuous back and forth with the patient than just surgery. And then I might not see them again for a while. So
Mm.
it's different kinds of relationships. And I love that it creates habits for people. I don't claim that it works for everyone and not
Mm.
everyone wants to do the work, but those who do, I feel like these are lifelong changes. And so that means a lot to me. I hope that every single person that I have touched can keep a place in their heart for the time that we spent together. And I was able to accompany them on their healing journey. It just means a lot to be able to be part of someone's life in that sense, you know?
Mm. It's like it's the real meaning of a doctor. It's a partnership and a teacher, isn't
Right.
it?
The
And
healing. No, you're right. The teaching and the healing, it heals me back. When I work with the right kind of patient for me, when I meet with these people, it's healing for me too. It really is.
mm.
Versus when it's not the right energy, it's not the right person, and they just want to take from you and they don't respect you and they don't follow through because they don't love themselves, they don't respect themselves. There's a lot of psychology to what we do that can be very disruptive emotionally for me. I have a lot of stress with that. I'm still trying to figure out how to be better at the selection process of the right patients that wants to go on that journey with me.
Yeah, I've learned that journey too. And I was having this conversation last night with my partner that my consultations forms are really long. And he was trying to biohack, well, how can they be shorter? Or you can use this AI form and it can be on WhatsApp. But I said, that's part of the compliance. Like, if they don't have the commitment to honor themselves and go into detail with that form, that's like a first. I'm not obviously, I'm still going to work with them, but it's still like a, okay, like how much are you worth to
Yeah.
fill in this form and have that time for yourself, and so we can create a partnership, and will you follow through on these lifestyle changes that will take time, but they will make a world of a difference.
I agree 100%.
It's an interesting one. And then going back to, you've worked in surgery and you're doing this functional medicine, you're doing amazing work with holistic health practitioners. Doing this work, can it prevent a lot of surgeries? Are you starting to notice?
There are going to be times where I do think it can, especially
Mm.
when some of the heavy bleeding is not related to really large fibroids or really bad endometriosis. There are going to be instances where the pathology, where changes have happened to a degree where it's very hard to reverse it. Okay. Because,
Mhm.
as I said, we don't live in a healthy world either. Even if you optimize everything, it's hard to be as clean and as healthy as maybe 200 years ago. But
Mm.
there are a lot of moments where women can experience so much improvement without surgery. And those are often people who have changes in earlier stages where a lot of it can be reversed. And I do see that as well. Absolutely. That is for me so rewarding because ideally I would want to avoid surgery for as many people as possible.
Mm, mm. And it goes to also how in tune are you with your body? Because I
Yeah.
think a lot of the time we don't know that we're stressed, but we just
Yes.
keep raising the bar.
Yes.
As we have to take on so many different roles and be so
Yes.
many different people, it's like
Yes.
if you look after yourself, well, something has to give, right? But
Yes.
it can completely
Absolutely.
change things.
I can give you some examples of patients where those changes were made and people felt better. Like, I had younger patients with really heavy periods and optimizing their ovulation and supporting them with nutrients. And addressing the gut health that is probably has to be implemented in most patients, has made a difference in heaviness or painful, the severity of the pain of the periods. And I have women where they have fibroids, but we implement some things, the fibroids are not as big yet, and then they don't grow further. We might not make them shrink a lot, but we might prevent them from growing too much. That can happen. Those cases exist. Doesn't work for everyone, and that's where
Mm,
some disappointment may lie as well, because we are all bio individually different, and we have a lot of factors that I'm not able to assess because I'm not living your everyday life with you. But if you maintain certain basics and do the groundwork and address the gut and the inflammation and the nutrients, you do allow your body to heal itself to the maximum it can. And then when it's necessary, then you would bring in surgery. But then if you do surgery, then I counsel patients with how to choose the right surgeon. Who is the right surgeon for you? What questions do you ask? And so that is also part of the education and teaching that the team that I work with and I can bring to the table. I think these are all very helpful because there is a lot of information out there, but not a lot of it is individualized. Women want to feel seen. They don't want to just have to grab info from a YouTube video, from Instagram, from people that don't know them. They really want to be seen on an individual level. We all want that human aspect of care. Like obviously everybody wants to hack it and use AI as much as possible and
mm,
automate things and processes, but it's hard to put women into some sort of algorithm. I've seen companies approach me with as an advisor in an advisory role, and I would meet with them just to see what they're offering. And in my
mm,
heart, I was thinking, there's no way what I do can be can be done in an algorithm the way they're trying to do so. It might work for a certain percentage of people, but when you want that individual care, you do have to work with a team that sees you and acknowledges that. And I'm finding more and more as I did this a little bit on my own the first couple of years, that I'm really enjoying have a whole team behind me that can be that the patients can approach, and then they have this community. So it's not just
mm,
one person, it's multiple people and multiple brains and multiple experiences coming together and advise
mm,
that client. It's wonderful. It's really helpful. And so I don't think I ever want to go back to just practicing by myself anymore.
mm. It's
Yeah.
honoring, I guess, the real traditional healing arts. You would have
Yes.
your team, your muscle, you would have your water therapy, your nutritionists,
Yeah.
your doctors, and everybody working for you.
Yeah.
Um, I want to go into that a little bit more, but before there's one question that I do want to dive into is like going off on a tangent, but honoring, menopause and
Yeah.
beyond. And I know a lot of your work is in this new kind of hormone rhythmic therapy too. And I know there's been a lot of fear with HRT, particularly in the old studies.
Yeah.
So I guess what are you noticing now with how women, because we're living so much longer now, how can we prolong the longevity of our wisdom years to honor that sacred time too with these therapies that you're introducing?
Yeah. So I use something called physiologic hormone restoration, which uses the natural rhythms of estrogen and progesterone, and to a smaller degree testosterone, the way it is in the reproductive years of a woman's. So the majority of menopause providers will give someone hormone replacement in a static dosing where every day you get the same amount. That is not necessarily based on any kind of studies showing that that is the superior way of doing it. It's just
Mm,
easier. And then a lot of studies just started doing it this way. And then because often with the synthetic hormones that they used before, we went into doing bioidentical, it was easier to dose them a certain way. What I work with is bioidentical hormones. What that means is that the chemical structure of the hormones is very similar to the way your own body would make them. So the receptors can recognize those hormones easier, and they will have the same function on the hormone receptors
mm,
that your own hormones would. You kind of want to try to imitate nature to your best ability. But in addition to that chemical structure, you can also dose hormones in a way that imitates nature as much as
Okay.
possible. So that dosing can be then going up and down throughout the menstrual cycle. You can imitate a menstrual cycle and you cycle progesterone instead of giving it daily. You cycle it and you elicit a menstrual cycle. And there's some data that that can be beneficial over giving the same dose every day. And that data, particularly when they looked at certain things like bone health, there is some studies showing that cyclical progesterone is more advantageous than daily progesterone. And there is some data with cardiovascular outcomes. Those studies actually used cyclical progesterone, not daily progesterone. Not all studies, but there are studies like that. And then there's a lot of anecdotal data of patients having been treated in this way for over 20 years based on the Wiley method and then something called physiologic hormone restoration that the Women's Hormone Network basically has patented that method. And so they have been using this for decades and it works very well for a lot of women. I believe what I get, the feedback I get from women is that they feel that they're closer to their natural wisdom because they're still working in this rhythm of biology. Because every woman, when they're in the reproductive years, has not only a circadian 24-hour rhythm, they also have an infradian rhythm that's a 28-day cycle based on a little bit on the lunar cycle, but basically it's based on how our ovaries regulate our hormones themselves. So if you continue that, you can assume that the receptors everywhere in your body, where you have hormone receptors in your body, respond very positively to that because that's how they were used to hormones coming in. There are
Mm.
studies showing that if you cycle hormones in a certain way, the breast tissue responds to that differently. So you might be more respectful towards that regular cell cycle, the regular life cycle of a cell, which is growing and dying. And that cell cycle
Mm.
is more stimulated in a natural way with that rhythm. So there is all that thought behind it. There's a lot more to it. But to simplify that, that is one way of hormone replacement that I offer women. Not everyone wants to do it, but the ones
Mm.
who do it, I've gotten very positive feedback and they don't want to go back. And then I'm very open to working with women with whatever works for them. So I don't ever push any certain way on anybody. So that's
Mm.
also something. I'm not dogmatic about anything, but I will look at the overall picture and give my opinion on what I think would work best for them.
And would they have to go on that for it's a long-term treatment?
Well, basically, with hormones, if you're going to make a decision to do hormones because you believe that this is a biology that happens, yes, it's natural to undergo menopause, but you don't want the natural consequences of it. You don't want your bones to become thinner.
Mm.
You don't want your cardiovascular health to decline. You want to maintain your skin thickness and resilience, the vessel walls. You don't want your gut health to change too much. You don't want your visceral body composition to your brain health. You want to support that. There's lots of data with that. So then you decide to go on hormones, then you can decide to stay on them as long as you want to. There are women that tell me nobody's going to separate them from their hormones unless it's their deathbed. And so that's their choice. And I don't take them off just because they've reached a certain age, because they're making that decision for themselves. And it's an informed decision. And they want the hormones because it's supporting them in their overall healthy lifestyle. It's allowing them to exercise. It's allowing them to sleep better. It's allowing them to regulate their appetite. So they don't want to give that up. And their sex life and their vaginal health and the libido, there's so much to it. And then if there are patients who say, I wonder if I need them, I say, let's take two off. And they realize what the changes are that they experience when they come off. And they don't really like that a lot. So
Mm.
I give everyone the choice, but I don't force people to come off just because they reach a certain age.
Mm. Yeah,
Yeah.
I think it's an interesting landscape for this regenerative medicine for women, isn't it? I suppose, what are you excited about mostly in this space of regenerative medicine? You've spoke
Yeah.
about stem cell therapy, which I didn't even dive that much into.
Yeah. So you can use your own body's growth factors. There are things like PRP, platelet rich plasma, or you can use your own body's fat stem cells or bone marrow stem cells. And you can use that to rejuvenate tissue in your body. You can use that for injections, for cosmetic procedures. You can use it for joint injections. And there is also some people who offer that for ovarian or testicular functions. So improve fertility, improve ovarian function. We don't have enough data to show how long lasting those benefits are, but we can improve the function because they can improve the environment. You do not make more eggs. You are born with a finite number of eggs, but you can make the environment in your ovaries around those follicles and eggs healthier and allow those eggs to survive longer. And that is something that if you combine that with certain supplement protocols, certain implementation of hyperbaric oxygen, detoxification. I work in a clinic where we do a lot of chelation therapy, heavy metal detoxification, mold detoxification. So if you combine things that your body needs to detox from, and then nutrients that the body needs to healthily function, and then lower inflammation by addressing gut inflammation and other immune system dysregulation. And then you bring these regenerative therapies. I sincerely believe that you can absolutely delay cellular aging because you're just optimizing your own biology. Now, will we get more and more data on this? Absolutely. Is it forever, or is everyone staying young forever? I don't think that should be the goal. And that's not what I personally would want. Do want to have the feeling that life is going to be over at some point because that makes the days that I have here more special. But do I want to optimize my health during the time I'm here? I try my best. Lifestyle through my career was very poor. I have to make up for a lot. I cannot reverse my ovarian aging. I cannot reverse that I'm in perimenopause now, but I can optimize the outcomes of my own health going forward and with whatever I can do for my body now. And that's for everyone differently. So yes, these regenerative therapies, there are some out there, and there are some people who go abroad outside of the United States and also use umbilical cord derived stem cells, which would be from someone else's umbilical cord of a baby. That the umbilical cord usually gets discarded. We collect the blood, those stem cells are extracted. Then there are some people who get those injections into the ovaries. Yeah. Not a lot of long-term data out there. Yeah.
There's so many emerging treatments, processes, but I think it's that collaboration, building your team and
I
your
agree.
holistic practice. So I know we're sadly short for time. I would love to ask you so many more questions, but how are you offer telemedicine? You have your practice in person in Florida. I can imagine you have a huge waiting list. How can people find more about your work?
Yes, well, I'm excited to work with, as I said, with the team of women from Her IQ, and they actually do a lot of education and they offer a lot of the testing. So if people are wanting to learn about periods and cycles and menopause, they could actually get hormone testing done, do their educational content, and they can work on the nutrients, inflammation, all of that. So by the time they get to see me, they're actually optimized so that we can see, do you need hormones? Do you not need hormones? And then we can decide. And then I optimize further with the hormones. But I love that. And ever since I've implemented that, I feel like that was the missing key, that approach of additional education and optimization before I even start the hormones. So everybody can reach out to Her IQ. It's heriq.co. I will share the links with you. They have an Instagram, and then my Instagram. I encourage everyone to follow for education. I do my best, full-time job, but I love sharing education online, working on my own hormone course because the way I do hormones is very different than majority of people out there. So I do want to create more educational content. So if you follow me on Instagram, then you'll be updated on what I'm putting out there. And it's Dr. Salome Masghati, MD. I love getting feedback on Instagram. People ask me questions. I love answering them. I just adore that interaction with people who are not even my patients. And so I get a lot of international followers. I love that. So yeah, so the Instagram accounts and then the website for me is drsalommasghati.com. And then there is the Her IQ website for the team of women that I work with that are basically have access to me. So that is ideal if someone wants to get in touch with me.
Well, I can certainly see or receive your heart, your care, your passion for and how you're really changing and pioneering women's health. It's such an important area. We need practitioners like you, and I think it's such a important collaboration that you have with HIQ.
Her IQ, yeah, we
Her
came,
IQ.
we all, me and the other co-founders, we came up with the name. We thought about, we want women to be
Mm,
as informed and educated as possible. So we came up with the name Her IQ. It's
I
basically,
love it.
yeah, we were so proud. We created the logo together. Everybody participated in the website. This is a labor of really a lot of passion and, heart. And everyone involved in that team is
Mm,
passionate about women's health. It's incredible because I've worked in different places. This is not about profit. This is about women and their
mm.
education. So I'm really excited that we have created that together. Yeah. Yeah.
Mm. And the more education, the more awareness, the more policy change, the more we can change and implement things
Yes.
so people don't have to be in pain.
Exactly. The more women can advocate for themselves. One of the things that we help women educate them on is if we are taking care of them virtually, they still have to go physically to their primary care or OB-GYN doctor and explain to them what they're doing. We educate them on how to approach that, what language to use, how to explain what they're doing. That bridges that gap for them very well. So that is part of that education that we offer. And I love that. And they get access to a community, and there is a blog and forums, and they can ask questions.
Wow.
There's too much care in between doctor visits because what I can offer alone is so limited. But what the
Mm,
whole team can offer together just surpasses what one person can do. So to me, that is the best way to practice medicine, and that's the future of medicine. It's a
mm,
team-based approach to.
It's community. We're coming back to that community. We heal in community. We heal together. It's a
Yes,
shared experience, isn't it? Particularly as women as well.
I love that the way you said that. I agree. That's exactly. Well, thank you
Oh,
for
thank
having
you
me.
so much, Dr. Salome. It's such a pleasure. I've loved
Yeah.
this conversation so much.